I am here to talk about non-cancer comparisons using the SEER MHOS data resource. Again, my name is Ben Allaire. I am a research economist at RTI International, and I just want to make sure and thank a couple of other folks who helped me put this together, Mark Horvath and Lindsay Koffel and Lisa Lines. So next slide, please. So what we're going to be talking about today is in particular matching techniques for cancer and non-cancer comparisons. And so the first, just real briefly, we're going to go through why you might need a comparison group and what its uses are. And then we're going to spend the bulk of the time talking about kind of what the processes are to go through matching. And we've got a 5-step process there that we'll walk through in terms of selecting covariates, choosing your method for balancing covariates, conducting the match, and then comparing the covariate balance, and then repeat, of course. And then we're going to talk a little bit about what do you do if you don't hit the balance, and we're going to talk about a SEER MHOS, an example that we've done here. And we'll finish up with takeaway messages and then a couple of resources for matching. Next slide, please. Okay. A comparison group is a really terrific tool in order to reduce confounding. And so now what is confounding? Confounding is when there's an apparently causal relationship between an exposure and an outcome, or an independent variable and a dependent variable that's actually distorted by the effect of a third variable. You can see in the diagram here, the independent variable has a spurious causation on the dependent variable, and it's really caused by this kind of confounding variable. And an appropriate selection of a comparison group will allow you to reduce the impact of confounding. And for our kind of example today, it really helps us explore what would have happened in the absence of cancer diagnosis for cancer and non-cancer comparison groups. Okay, next slide, please. Comparison groups, the selection of comparison groups is increasingly popular among cancer researchers. I have this little kind of bullet over here that says, the number of cancer studies utilizing propensity score matching, so it's matching techniques, in high impact journals grew over 5 times from 2009 to 2017. So this is an increasingly popular tool in the health utilization toolkit, health services researcher toolkit. And like I said previously, it really helps you examine what would happen in the absence of a cancer diagnosis. Okay, next slide, please. Okay, and so, like I said, the confounding risk can be mitigated with a quality selected comparison group. And so how do you do that? Well, really, the comparison group needs to be selected so that it's selected and designed to be as similar to the intervention group as possible on socio-demographics and clinical characteristics. So if you're using SEER MHOS, you want your cancer and your non-cancer group to be as similar as possible on those variables that are related to cancer, and we'll get into that in a sec. But you want them really to look very similar. The most popular methods for minimizing covariate imbalance, and so we want to make sure that the covariates are, in order to look similar, are balanced between the two samples. So if you're minimizing the imbalance, you typically involve cohort matching, which we'll talk about. It's also, some people like to call it trimming, and sample weighting. Those are the most popular methods. Okay, next slide, please. So the first step in conducting a matching or weighting and selecting your comparison group is to select your covariates. And really in the literature, this is it's a critical step, and it's often kind of underreported in terms of the motivation for selecting those. So what kind of covariates should I look for when I'm doing that? And really what you want to start with is variables related to what would be in the group of interest, so like related to cancer for our purposes, and then also the outcome of interest in terms of health-related quality of life is a common outcome of interest that folks using CRM-HOS do use, although there are a variety of really terrific outcomes that folks use when doing research with CRM-HOS. I think, when you're starting out, especially if you're starting with propensity score matching, which is usually the most common technique that folks use, there's really little cost to having a more liberal inclusion criteria for your matching. So there's little cost to it. So you want to be kind of expansive when you're thinking about what variables to include in that match. Next slide, please. So we have a couple of suggested covariates in CRM-HOS. In particular, age, sex, and race are really the most common and are highly recommended when you're starting out. And those are really, there's a lot of strong evidence to show that they've been related to cancer incidence. And so therefore, really recommend starting with those three. Now, other variables such as education and proxy survey response are also ones that you should seriously consider including in matching. Then there are additional variables such as income or smoking, and including those might be useful. Some of it will depend on your research question, and some of it will depend on what the missingness is, in particular for income. That is something that because CRM-HOS consists of Medicare patients, typically income is not reported, and so that can be a real challenging one, but maybe useful depending on what your research question of interest would be. Next slide, please. Okay, so now we've come to, you've selected your covariates and you know that you're going to match. What methods are there available? So the first one, I just have propensity score matching because that, again, tends to be the most popular one. But there is also weighting, and there's propensity score weighting. There's a whole smattering of different weighting techniques in terms of inverse propensity score weighting and other types of ways to select those weights, and then exact matching. So now what are these three techniques? So propensity score matching essentially takes this all of these covariates and kind of balls them up and mashes them into one single variable, which is the propensity score. And for our interest today, that would be the propensity to have a cancer diagnosis. And it takes all of those variables together, and now that you have one summary variable for that, then you match on that propensity score. And those people that have the similar propensity scores will have similar covariates. And so that is the is really the workhorse of matching, and is a good, if you've never done matching before, it's a good place to start. The second one is weighting, and weighting attaches weights to the comparison group population in order to make it look more similar to the population of interest. So it'll upweight folks that look more similar, and it'll downweight folks that look more dissimilar from folks in the group of interest. So that's another technique. And finally, there is exact matching. And exact matching is precisely what it sounds like. You take all people with, for example, if we had age, sex, race, then you would match only people with the same age, sex, race of your population. And I would tell you that there are other matching techniques that are not included on this, although this is kind of how I tend to group them, just in terms of an easy heuristic to think about. Next slide, please. And so this is just a brief discussion of some of the advantages and drawbacks. What matching method you pick is going to be dependent upon your research question. And so I've tried to kind of lay out what some drawbacks are. So some advantages and also some drawbacks. So in terms of propensity score matching, it's very straightforward to apply, which is good. And then your sample losses. So one of the challenges in creating matches for your research question is that you may lose people. That what do you do essentially with people who don't have matches? And oftentimes they are just tossed off to the side and not used in our research question. And so really the goal of any researcher should be to maximize that potential sample loss in terms of the group of interest, because you don't want to lose very many. Now, some may be okay and may not change the inference that you have with that, but you really do want to try and minimize it. And then finally, propensity score matching has the largest literature. So if you have real specific questions about what to do and what choices, there are many choices that you have to make along the line, and we'll talk briefly about those and how to make those choices. There's really great guidance there. Some of the drawbacks to propensity score matching is that because you summarize all of these characteristics of this population, if you want to do subgroup analysis, so you've got cancer, but you want to do you've got a whole bunch of different cancers that you want to look at, but then you also want to break it down and look at individual cancers by like prostate cancer or colon cancer, let's say. That requires you to rematch at the cancer level. If you just match it overall for all those cancers, you will not be able to conduct subgroup analyses and maintain that balance throughout. It can be computationally intensive. There's a possibility that if the size of the groups are relatively disparate, so like you have a ton of people who are in your outcome of interest, but then you have a very small comparison group, or vice versa, that you could have convergence issues with your propensity score model. That is a concern. And then there's no guarantee of balance. So you may need to rematch and think about clever ways in terms of to achieve that balance. In terms of weighting, one of the biggest advantages of weighting is that there's no sample loss, right? You have everyone. And so that is definitely an advantage to weighting. One of the drawbacks is that sometimes you may have, if you have maybe some very small subgroups, you may have very large extreme weights, and you'll have to think about clearly about what your strategy is in dealing with those large weights. Finally, in terms of exact matching, there's no balance checking, so that is an advantage. It is by construction. You will have achieved that balance. There is no misspecification or convergence issues, so it's non-parametric, which that also makes it very easy. And then, of course, because you have, by construction, you have made an exact match, you will be able to do subgroup analyses very easily, which is a great advantage. However, the real strong drawback to exact matching is non-trivial sample loss. What do you do if you have a bevy of covariates and none matches your outcome of interest? Do you have to drop those people? And that can be a very, very real concern for exact matching. All right, so those are some just brief advantages and drawbacks to the three strategies. Next slide, please. Okay, so step 3 is conduct the match if matching, but obviously if you're waiting, you needn't concern yourself with that. But for exact matching and propensity score matching, you will have to consider some of these questions. For exact matching, just the last one for the most part. But for propensity score matching, you have to think about what type of matching algorithm you will use. So if you have two folks with the same propensity score, how will you select the ones that are close? What does close mean? And so that's essentially what your calipers are. It's the distance between your the propensity score for your group of interest and the propensity score of your comparison group. You also have to make a choice of with or without replacement. So the question is once you have selected a comparison group person, are they done, or are you allowed to select them again for perhaps another person in your group of interest? And then what is the distance for that caliper? If you do, caliper is that distance between the different propensity scores. What's the right distance to select that at? So there are a couple decisions to consider. I'm not going to go through each one of them and what the current guidance is. At the end of this presentation, I have some resources to consider in terms of making those decisions. But I will say that there is a large literature on each of these in terms of what the best way to go is. And then for exact matching, this is a real big question, which is how many strata. So that's how many people, perhaps of an age, sex, race. If your if your group of interest includes older adults, maybe those that are 66 and female and of Caucasian race, how many other comparison group people are there that look just like that? And so, if you don't have anyone that is that exact age, sex, and race, you may have to drop them, and that poses challenges to our conclusions that we might draw. Next slide, please. Okay, so after you have matched, we have talked about balance and checking balance. So what do you do? How do you check balance? How do you know if it's balanced? So the first thing you should always check is how much sample loss. And I've hit that point a couple of times. So just to double check, oftentimes a rule of thumb is like if the sample loss is greater than 10%, or perhaps your balance is not achieved, you really should reassess the match, and we'll come to that in a sec about what steps you should take there. But in terms of checking balance, how we know that to be the case is I put a couple of different ways to do that. First of all, standardized differences, which are essentially the differences in the variables divided by a pooled standard deviation. And that is really the most accepted measure of univariate balance. So you'll do this for each one of your covariates. Just as a rule of thumb, anything greater than 0.1 is typically considered unbalanced, but there are various different rules. I tend to be a 0.1 guy for that. Another thing to look at is the ratio of the group of interest and the variance ratio of the group of interest and the comparison group, the relative variance of the two in a covariate. So if the dispersion is the same between the two, or is one much higher than the other, and that might be kind of covering up some differences that might underlie the distribution of that covariate. The other thing that's really useful, I think, is to plot cumulative distribution functions of the propensity scores or of matching variables. And you can see on the right here that we have an example of the cumulative distribution of the propensity score. And you can see in the one on the top, there is much less overlap than the one in the bottom. Actually, in fact, in the bottom one, you really can't see much overlap at all, indicating that this was a relatively successful match. One thing that I do want to note is that significance tests, so like p-values and things, tests of that nature, are really not recommended, and that's predominantly because they are impacted by sample size. So if you have a huge sample, you're unlikely to achieve balance if you are using significance tests to do it. Or in contrast, if you have a small sample, it may look like you've achieved balance, but you really may be pretty different in between the matched and the comparison group and the group of interest. And so there may be issues there that sample size is masking. All right, let's see. I think that is it. So if we go to next slide, thank you. Okay, the next step is repeat. And I have a bullet here that says matching and weighting is more art than science. I think there is really some truth to that because there are so many decisions to be made throughout the matching process. What covariates, how do you specify those covariates, and all the different various matching decisions that you have to make. Really, it can be really challenging, especially if you don't achieve balance, to finally get there. And you have to kind of think cleverly about really how to get those two groups as similar as possible. And so, that may mean re-specifying covariates. That may mean a variety of different ways. And so one of the things that I would encourage you is if you are conducting a match, that you plan ahead and assume that you will have to rematch and set up systems and programs in place for you to easily rematch and easily check balance so that you know that you will have to do it again. This is just I have been doing matching for over a decade now, and just some lessons learned from someone who's done this before a couple of times. All right, next slide, please. Okay, so what do you do if you cannot achieve balance? You've tried all the tricks that you have. You've re-specified this variable or matched this way. What do you do if you don't achieve balance? And I think the first thing to do is try again. And so it's to try and step back and think, okay, what can I do to really achieve balance? But the next thing, if that really is no longer an option, is you can take the variables in which you do not match on. So this would be variables, if it were me matching, it would be variables in which my standardized bias is over 0.1. And I would take those variables and I would put them in a regression framework and take the outcome of interest and put it on the left-hand side and run a regression. And so that way you are controlling for the variables in which you know that your populations differ on. And that can be really a powerful way to make sure that you are controlling for all the differences. Because there may be, especially if your model is large and you have a lot of covariates that you are trying to match on, you are guaranteed almost, if they are a large difference, a large set of covariates, then you are almost guaranteed that you will not match on all of them. And so you may need to control for some of them. Okay, next slide, please. All right, so I did want to take an example from SEER MHOS. This is a draft manuscript that we've partnered with NCI to produce, and we have done some matching with that. Now, the research question that we were looking at was looking at HRQOL, which stands for Health-Related Quality of Life Scores, and we were looking how they changed, how they have changed over time in the SEER MHOS sample. And on the right-hand side, you can see here, I've conducted a propensity score match. And this is, I tend to be a Stata user. And so this is using a Stata command called psmatch2, but there are a variety of different Stata commands that you can use. And you can see on the right-hand side that I've plotted out the standardized bias. It comes in the command. I didn't write this myself. And you can see the little X's occur where the standardized bias is on the axes there, and the circles are how much we've reduced the standardized bias by matching. And so you can see at the top, age was very biased in our two samples. And then you can see that on down the line, that they become less and less. The comorbidities that we have in there, so that's what the CVD DIS is. So like that's CVD, and so we've got a couple of different of those, and we've managed to reduce the bias a fair bit. I will tell you, I think when we look at the race variable, there may be some standardized bias that's greater than 0.1, and so in this model, we actually included the race variable as part of our covariates when we after we matched, because we were unable to get it under that 0.1 threshold. So we included that there. Next slide, please. Okay, and this is the outcomes, and this is what we were kind of talking about when we consider the confounding that's really useful. So on the left-hand side, you can see the physical health trends for SEER MHOS respondents with and without cancer. Now the dotted line, the orange dotted line, and the blue dotted line, the orange one is for those with cancer, and the blue one is for those without cancer. And you can see on the left-hand side that the trends in here are mostly positive. It's slightly upward sloping. It's maybe a little bit hard to tell, but it is slightly upward sloping. So, you know, if we were to look at this trend by itself, so if we were to just look at the blue line and to test, you know, in this in the more recent times versus the older times, you would actually find a statistically significant difference. However, with this comparison group, once we sort of net out the changes in the comparison group, that change is actually statistically insignificant because the trends are kind of similar. And so we are able to kind of say like, okay, that those differences net out. However, if we go look on the right-hand side and we look at mental health trends, the scale is the same, and so you have the PCS score is over on the left-hand side there. You can actually see that the blue line and the orange line actually cross, and when we net out those differences, we actually see that the cancer folks have improved relative to those without cancer, and sort of makes an interesting kind of comparison of the two. And we can hypothesize about what reasons there are for that, but it still remains that from the earlier period versus the recent period, cancer patients from a mental health perspective have improved relative to their other cohort without cancer. Next slide, please. Okay, what are our takeaway messages? So first of all, selecting an appropriate comparison sample will allow you to minimize confounding concerns, and I do really feel like that's a good one. And you definitely, when you're starting your research question and you're considering what that is, you need to think about what confounding concerns might there be. And then one thing I would hope that you would take away from this talk is that matching and weighting techniques are straightforward to set up and implement. You can do this, and you should do it if it is relevant to your research question. And there are a host of software options for you if you would like to do this. And then finally, the one takeaway message is that matching is iterative. I've yet to, for myself anyways, to encounter a research project in which I've conducted one match and I've stopped there. It has yet to happen for me. Maybe it will someday, but it hasn't happened yet. And so my take from that experience is that you should plan on it being an iterative process. All right, next slide, please. I put in here just a couple of guides that I would recommend if you are unfamiliar with matching processes that would be useful resources and were useful to me when I've conducted all of these. I've done all of the matching techniques listed here. There are definitely some that I have not done, but in particular, the Caliendo and Kopnig, 2008, and the Stewart and Harrison Horst are just invaluable resources. And if you do decide that starting on this, conducting matching is really something that you want to do, I really recommend starting there. In particular, the Caliendo Kopnig resource, it's from 2008, so it's a little bit dusty, but it's very clearly written and is very accessible in my opinion. For weighting, really recommend Austin and Stewart is a really good resource. And then Lee, Morgan, and Slavinsky, hopefully I haven't butchered that too much, are also, both of those tend to be wonderful resources for weighting. And then for matching, the Iacus, King, and Porro is sort of the seminal work on coarse-to exact matching, which is what I tend to use when I have done matching. And so recommend if you are going to go down that path that you start there. All right, next slide, please. So we have references here, and I believe that's it for me.